have from our own university, Mohannad, Nour, Alif, presenting music as a non-pharmacological method in manipulating anxiety in modern dental procedures. Please allow me to welcome Mohannad Alif.
Thank you. Well, good morning and good afternoon, everybody. I see a lot of familiar faces and a lot of unfamiliar faces from all around the world. Well, I say to you, welcome to our humble university. Now, well, my name is Mohannad Alif, and I'm going to be talking to you about our project, which is about music as a non-pharmacological method in reducing anxiety in our daily dental procedures. Now, before I start with my presentation, I'd like to tell you something about myself. Now, I don't like to do things normally. I don't like doing it ordinary. I like to go over the limit. I don't like knowledge based on its own. I like combining knowledge with entertainment. I think that's the way to go and learn more. So, starting off, I'm going to guide you through my presentation. I'm going to tell you this small introduction about anxiety and music. Then we're going to go about why did we choose our study. I'm going to tell you our objective of our study, the methods we used, our results, and then go into discussion and conclusion. Now, what is anxiety? Now, anxiety is not uncommon in our daily practice as dentists. We face it every day, and it's very significant. As many patients, they skip appointments, they keep rescheduling appointments because they're anxious, they're afraid. And now, as we all know, anxious patients, they are more prone to syncope or any emergency, and they all have a lower pain threshold than normal patients. Now, music is widely accepted. Now, we all listen to music, we all like music. I was listening to music right now before I went up on stage. Well, by many studies and researches, music therapy has been recommended as a method in reducing anxiety. So, how can you define music? I mean, can you tell me what's music? No? What about you, Hisham? Can you tell me what's music? Something that makes you move. Alright, there's a point to it. Well, hold that thought inside. I'll tell you how you can define music in a little bit. Right now, open your ears and tell me what do you think. Do you think this is music? Alright, maybe not everyone likes this type of music. How about this? I can't let you listen to the whole music. Now, maybe you aren't like me, you like a different kind of music. This is rock, Guns N' Roses, if anyone's familiar with it. Or maybe you're one of the few breed, you like the classical type, the legendary, the epic type of music. Personally, I like it. Or maybe you just like to sit down and relax to some quiet music. Well, I don't have all day to let you listen to the whole music. So right now, can we know what music is? Now I've been looking at some of the faces of the people around here. Now with every type of music, I noticed some differences. Some people didn't like it, some people liked it, and some people were happy about it. Now see, that's music. You cannot define music solely by words. Music is emotion. Music is something that your soul can reach out to and touch. Now it has been there since the beginning of time. Complex, simple, fast, slow, loud and soft. I mean, it can even relax you, it can put you in your own world, and sometimes it can even save your own life. So, like Morgan Freeman said in the Shawshank Redemption, I mean, that's the beauty of music, and they cannot take that away from you. But keep in mind also the danger of music. Music can induce emotion, any type of emotion. It can make you happy, it can make you sad, it can make you aggressive and give you depression. And believe it or not, it can make you suicidal. So you have to choose your music preferences really precision. You have to choose wisely. Now, why did we go into our study? I mean, did we want to know more about music? Maybe we were just curious. Hell, we're students. Maybe we just felt like it was something to do. Or was it personal satisfaction? Now, it was, to be honest, it was a combination of all of them. To me, well, it was personal satisfaction. I have passions for music. I love music. I want to know the whys behind the music, the tunes, the ups and downs, the highs and lows. And I love dentistry as well. And I want to see at first hand its effect. And I want to combine it in the profession as well. Now, we went into a lot of research. We went back to the basics of music. We read the book Birds of Fire, Jazz, Rock, Funk, and the Creation of Fusion. Then we had some articles from many scientific journals, the Neuroscience and Biobehavioral Journal, the International Journal of Psychology and Counseling, the Human Brain Mapping Journal, and that one I keep forgetting, Behavioral and Brain Sciences. Now you see, the brain is an amazing thing. It's complexity and simplicity at the same time. It's amazing. When you're up, when you're awake, when you're asleep, it's still functioning. Now, it has been classified in 4 stages of beta, alpha, theta, and delta. These are frequencies released by the brain. Where you are in beta frequency, right now you're all in beta frequency. You are active, you're thinking, you're concentrating. The alpha state, which all studies point into inducing alpha state. Alpha state is when you're relaxed, you're not thinking, and you're calm. A lot of studies proven that music does induce the brain to alpha state. Now, theta state, which is the deep relaxation. Now, there are studies that show some type of music that puts the mind in the theta state, but there's limited research and it needs more research. Delta is when you are asleep. Well, even when you are asleep, your brain is functioning. So our objective was, we wanted to see if music was an effective method to reduce anxiety in our daily dental procedures. Now, we conducted our study. We had a randomized clinical trial. We had 70 participants, according to operative or periodontal treatment. They were separated into 2 groups, the treatment group and the control group, made up of 35 participants in each. Now, I'm sure you're all familiar with the porous dental anxiety scale. We use that to measure the pre-anxiety levels of the patients. Now, the porous dental anxiety scale, as we can see here, it can be better now, okay? It's composed of 4 questions, each question that has 5 answers. Each answer has its own value. Now, after you answer those questions, you have an accumulative value of maximum of 20. Depending on that value, it rates you in a category of anxiety. If you score less than 9, you're in the no or low category of anxiety. If you score between 9 and 12, you are in the medium anxiety category. If you score 13 or 14, you're in the high category. But if you score more than 15, you are put in the severe or phobic category. Now, if you reach that way, you have some issues. You have to seek psychiatric help. Now, we also asked the operating dentist to rate his patient according to how acceptable they are to the treatment plan at hand, from a scale from 1 to 6. 1 as being hesitant, non-cooperative and non-accepting the treatment. 6 being very cooperative and accepting the treatment. Now, after the treatment was done, we asked the patient to rate his level of anxiety from a scale of 1 to 6. 1 being very low anxiety, or 7 and 7. 1, 7 being very high anxiety. Now, we had 3 choices of music, which were approved into research. We had the classical type of music, we had jazz and blues, and we had neuro-linguistic programming. Now, classic and NLP are already proven in our medical and dental field to have effect. But coming to jazz and blues, there isn't much research supporting this genre of music. So we went with jazz and blues. Now, we had music instrumentals, of course, they're not lyrical, from 2 musicians. I don't know if you're familiar with them. We had from Larry Cobbleton, he's a jazz musician, and my own dear friend, Helen Ray. Now, music was delivered directly into the patient's ears through headphones from an MP3 that had 19 minutes worth of music. Now, what did we want to answer out of all study? Why are we doing all this? Now, we wanted to know, is there actually a difference in the mean anxiety levels between the patients who receive music and the patients who did not receive music? We want to know the answer to that. We did our study, we got our data, and we analyzed our data. Then we got our results. Now, we had 55.7% males and 44.3% females. They had an average age of 32.7 with a standard deviation of 9.6. Then we got the preoperative anxiety measurements from everyone. Then we classified them into sex, age, and marital status. Now, we did have some shocking results, and we did have some results that were ordinary, that were predictable. Now, first of all, I like this one personally. Females have more anxiety than males. Yeah, most of the guys like it. I mean, that's true. There's nothing to be ashamed of it. It's basic physiology. It's even proven. They have fluctuant over the month. They have fluctuant levels of estrogen and progesterone. That's normal. That's women. Get used to it. Now, then coming to the marital status. Now, this is my second favorite one. Now, married people reported more anxiety than single people. But single people had more levels of severe category anxiety. Now that we can relate it to, as a married guy, you have a wife, you have a kids, you have more visits to the dentist, you're going to be more experienced in that, and your anxiety is going to reduce. But being a single person, you're not motivated, you will not go to the dentist, but when you go, well, he's not going to find you, you're going to be in the bathroom. Then coming to age, now we found as well that as you grow older, your anxiety levels will decrease. Also relating to the experience of how many times you went to the dentist. Now the low age group, which were between 15 and 25, they had more anxiety levels of high and severe. But in the moderate category, we had more in the middle age group, 36 to 45. Now some people might relate that to middle age crisis, but I'll tell you myself, middle-age crisis is a phenomenon. It's not true. Even it has been classified by psychoanalysts, Ergison and Juke. They classified it, it's not true. It's only in your head. It's something that has been put, well, I don't want to go through into it. I can talk about half an hour about middle-age crisis. But it's not true. It's false. It is. No research has ever proven it. Now coming to patients who were in operative and periodontal treatment, we had 52% patients who were in operative treatment, 48% in the periodontal treatment. Now, our study has shown that people coming in for operative treatment, they have more levels of pre-operative anxiety, with a regression value of minus 0.52 and the significance of 0.05. Now we can relate that when you go into periodontal treatment, the patient knows you're not going to drill his tooth, but you go into operative, he knows you're going to drill, but he doesn't know how much you're going to drill. The operative might know, but if you experienced it as a patient, you do think that he's doing a big hole and he's going to your brain. There is no perception of that idea. After we got all that, we got our post results. Now, to the people in the treatment group, post-operatively, they reported, most of them reported low levels of anxiety. So they had in the low category and the medium, a little bit in the medium category, but patients who were in the control group, they reported medium and high levels of anxiety post-operatively. Now it had a regression value of minus 2.1 and a p-value of 0.00, which is highly significant. This was shocking to us as well when we saw it. We didn't expect it. Now, we said that females, they have more anxiety than males. Said that marital people have more anxiety, but single with more severity. As you grow older, your anxiety will go lower. Music will reduce your level of anxiety. Now, but as our study has shown in conjunctive with other studies, people in the severe category, they cannot, you cannot just treat them with non-pharmacological methods alone. Non-pharmacological methods should be in conjunctive with pharmacological and psychiatric methods, antidepressants, medications. Now, music is an very effective method to reduce anxiety. And it's found also in our study, which we conducted with others, that music will reduce your anxiety regardless of your age, your sex, and marital status. Music is not racist, people. It will work. Now, I believe that this is of utmost importance, and I urge dentists all over the world to implement either a direct or an indirect approach to music in their own profession. Now, as all studies have, we had some limitations. Now, I did tell you about the dentist rating. Well, we had bias in our dentist rating. Why would you say that? Dentists were not calibrated. Each dentist was actually his own patient. Each dentist has his own perception of what anxiety is. So one dentist in psychological training would be more efficient. Music as a direct approach. Now, some patients, they reported it's forced, not passive. That's where indirect comes in, as it being passive and cheaper and wider range. Now, I'd like to show you a glimpse of one of the tracks that we used in our study. Well, I don't have enough time to show you a whole track. It's 5 minutes long track. Well, anyways, the brain is a magnificent thing. It's complex and simple at the same time. It's induced by it's affected by a lot of things around us. So if we, as dentists, we can manipulate that into our own advantage and control the emotions, but of course not abusing it, we can't go mind controlling our patients. Use it in our own professional and ethical way. Now, I would like to thank Dr. Manal for supervising and guiding us through the presentation. And as well, I would like to thank my lovely group. I can see a couple of them over here. And most of all, I would like to give my thanks out to that girl over there, Tasneem Hisham. Her dedication was amazing, and she went to the end. She's not getting the accreditation that she deserves. Thank you, Tasneem.
Thank you,
Thank you, everybody. If you have any questions, don't hesitate to ask me.
For your very catchy and attractive presentation. I liked it very much, although it's a bit more compatible with a lecture than a research conference presentation. It's very nice. But I missed the answer to your question. Did music reduce anxiety?
Yes. As I said,
at the end slide showing the mean score in the intervention group compared to control. You showed in males, females,
yes,
there was no slide on the effects of intervention.
There was one slide showing the results of the post-treatment with the regression compared from the treatment group and the control group. I said that there was a regression value of -2.1 and a significance of 0.00 compared both groups together.
Oh, maybe I missed that. Okay, thank you.
I'm sorry, I kind of talk a little bit fast sometimes.
Thank you very much for this nice presentation. I want to ask you, not asking actually, it is your kind of research is very, very inspiring for conducting more research to translate the parameters to a measurable parameters, because you know your study is a questionnaire made, and I would rather like to transform these results by measuring the EEG, the alpha and the beta and the theta waves. So your numbers will give you an exact estimate about the patient condition, about the relaxing state. But anyhow, it's very nice and mesmerizing presentation. Thank you very much.
Thank you, Doctor. Now, I had that in mind. Now, as I was doing, we don't have enough funding, but if it's done in the future, I would recommend enough funding to do an ECG for all the electric waves. We might even do ECG, full blood EEG, and even blood tests measure markers and cortisol levels, but that requires a huge research center, patient volunteer, and a huge bigger funding. Thank you, Doctor. Anyone has any other question?
Yeah, thank you for this wonderful presentation. You've been inspired. I wanted to ask, the patients that were coming to you, were they suffering from any other diseases like already anxiety levels, and were they already listening to music before? Did you ask them that were they exercising this therapy of music? Because if there are people who are listening to music before, that might have, a lesser impact in reducing their anxiety level because they're used to it. And there are patients, for example, listening it for the first time. That's the first question. And the second was, what was the age group, in which you found greater reduction in anxiety levels, and did you have a specific age limit where you said it was just
The post-op, I mean.
not in the post-op, while selecting the patient, was there any specific age limit where you said
No, it was non-minor. I mean, he's more than 18 years old, and any age, because we wanted to see the effect on different age groups.
And what about any other diseases that he's already said?
No, that one we didn't choose it. We went with healthy patients and who didn't have any experience before in musical therapy.
Okay, so they did not listen to music.
They were not induced in musical therapy. They listened to normal music, but not as a therapy.
Oh, thank you.
Mohannad. You said at first you played different types of music, and you said that different people prefer different types of music. How did you choose your piece? Like, how did you implement music? What if that certain type of music causes more anxiety for the patient?
Yes, our topic music, we chose it after careful research from recommended researches and studies, all from the journals and psychology and brain mapping. As I said, we were limited down to classical jazz and NLP. But since classic and NLP, they were proven to reduce anxiety in medical and dental treatment, jazz has limited, but it was confirmed to induce alpha waves. So we wanted to try jazz music.
All right, thank you.
Thank you, Mohannad, for your outstanding performance. And now, for the last presentation of this symposium, with Nour as well,